There's a common misconception that falls are part of the normal aging process for elderly patients, and that's simply not true. Falls are a leading cause of both hospitalization due to injury and death due to injury in the patients age 65 and older.
Anyone can fall, but I think as you get older, it's just really important to have this on your mind all the time. I was walking toward Macy's, and it was 45-mile-an-hour winds, and I was just focusing on getting in the door. But unfortunately, I tripped over the curb, and I was kind of embarrassed, but a group of people came around, and one of them helped me up.
I'm Dr. Randy Jernasik. I'm the Vice President of Medical Affairs at the Ohio Health Physician Group. I've practiced for many years, both in the emergency room setting and in the primary care family medicine setting.
One of the things I've discovered is that if I don't bring it up to my doctor, they don't ask about it, and I think they should because of the fact that everyone I know has fallen, and including myself 8 times.
The impact is high on the individual patient and their families. But what's also not realized is it's a significant cause for loss of independence and an inability to stay in one's own home long term.
Falling has impacted my life because I have 2 bad knees now, and now I'm possibly a candidate for knee replacement.
The economic impact of the state of Ohio is very significant also. It's estimated that treatment of these injuries in the age 65 and older group cost the state of Ohio approximately $1.8 million a day. That adds up to over $646 million annual of treatment costs simply for the falls themselves and the injuries related to that. When you expand that out, the age 65 and older group, it's an interesting demographic. They make up approximately 15% of our state's population. However, they account for approximately 84% of the fall-related fatalities within our state. So the cost or the impact, if you will, on the falls related to the patients, their families, the state of Ohio, and our healthcare system is vast. I'm excited about a new program that's being introduced in Ohio. The program is called STEADI. It's an acronym for Stopping Elderly Accidents, Deaths, and Injuries. The components consist of a gait and balance evaluation for patients, and then some other very simple interventions. Then call out 4 of them that are very specifically important. 1 is an evaluation of the medication reconciliation, including the use, when appropriate, of vitamin D. 2 is a visual assessment. This does not have to be a complete visual assessment, but a gross visual assessment that can be done anywhere is very appropriate. Next is an evaluation of the home for safety. Again, that does not have to be done in the home, but an evaluation by talking to and addressing patient or families. And then finally, and very importantly, is exercise education. Those are the simple components that make up the STEADI tool and what make it to be such an effective and easy to use tool. The best time to get a falls risk assessment is when you come to your physician or your practitioner's office. This is the ideal place because you can be connected to other resources to help you if you're identified at high risk for falls. The providers are able to identify your risks, medically and appropriately treat or refer you for interventions that can help reduce your risk. Medicare and the federal government and the CDC have recognized that this is such a high burden on our society that a falls risk assessment, such as STEADI, is provided free of charge in the initial wellness visit for Medicare, and it's also part of the annual wellness visit that Medicare provides for its beneficiaries. As a family physician, we're well trained to look at prevention and to prevent disease and injury from happening. I can't think of a better tool than STEADI to use in your practice to be able to identify this, identify patients at risk, and to prevent injuries from occurring. So I'm asking you to join me and help provide STEADI in our primary care practices and do what we family physicians do well, and that is prevent illness, prevent injury.